Hello, my name is Nicole Sprague and this video is for kinesiology. So our first two movements that we're going to talk about are flexion and extension. And flexion is when you decrease the angle of the joint, so bending at the elbow, and extension is increasing the angle of the joint, which would be straightening the elbow. And the elbow is a hinge type synovial joint. The next two movements are abduction and adduction. Abduction is when you move the limb away from the body, and adduction is when you move the limb towards the body, and this occurs at the shoulder, which is a ball and socket joint, and that is a synovial joint. The next two movements are eversion and inversion, and eversion is when you rotate the ankle so that the sole points away from the other, and then inversion is rotating the ankle so that the sole points toward the other, and the ankle is a subtalar joint, which is synovial. We then have external rotation and internal rotation, and external is when you move the limb away from the medial part of the body, and internal rotation is rotating the limb towards the medial part of the body, and this is occurring at the hip, which is a ball and socket joint. The next two we have are pronation and supination. Pronation is when the palm is facing down. Supination is when the palm is facing up, and this occurs at the radio-ulnar joint, which is a synovial pivot type joint. So pronation, supination. The next two are dorsiflexion and plantar flexion. And dorsal flexion is going to be toes down, while plantar flexion is going to be toes up, and this happens at the ankle, which is a hinge type synovial joint. The next two movements are dorsal flexion and palmar flexion. So dorsal flexion is when the wrist is going to be back towards the arm, and then palmar flexion is when the palm is facing downward. So dorsal flexion, palmar flexion, and this happens at the wrist, which is a condyloid synovial joint. The next one is called circumduction, and this is going to be a circular movement of the limb, like so. And this is happening at the shoulder, which is a synovial joint. The next two are elevation and depression. So elevation is going to be moving a body part in the superior direction, like so. And then depression is moving the body part toward the inferior direction. So this happens in the shoulder and the scapula, which is a synovial joint. So elevation and depression. And then the last two are retraction and protraction. So retraction is going to be moving the shoulder blade towards the spine, while protraction is moving the shoulder blade away from the spine. And this happens at the sternoclavicular joint, which is a synovial joint.